Hello, hello. My name is Jones, and I welcome you to Revision in Mental Health and Psychiatry. Okay, so within these short revision presentation, our first lesson was on eating disorders. Now we are looking at sleeping disorders in mental health. Okay, so sleeping disorders encompass a wide range of conditions that affect the quality, the duration, and the timing of sleep. These disorders can have a significant impact on overall health, well being, and daily functioning. So, some examples of sleep disorders may include conditions like insomnia, sleep apnea, narcolepsy, restless legs syndrome. We also have parasomnia. We also have cardiac rhythm sleep disorders. And lastly, we have hypersomnia. So, management and treatment of sleep disorders will depend on specific condition that might have led to the sleeping disorder that has been diagnosed. So, for one to improve their sleep pattern, they might need to adjust in terms of their lifestyle. They might need behavioral therapy. They might need some chemical therapy or medication. And in some cases, some medical devices can be used to correct a sleep disorder problem. Okay, so sleep is typically divided into different stages, each characterized with a distinct pattern of brain activity. So the two main categories of sleep are rapid eye movement. Okay, then we have non-rapid eye movement sleep. Okay, so when you're looking at the physiology of sleep, we look at the non-rapid eye movement, which has got four stages under it, and then we have the rapid eye movement stage. So when appreciating the non-rapid eye movement, what we have is that brain activities are lower than that when one is awake. So as you can see on the other side here, where we are trying to show in form of waves. Okay, so here the person is awake, and these are the waves. That this is how the waves are going to show when a person is awake. So we are saying, in talking about physiology of sleep, in non-rapid eye movement, the brain activity is lower than that of a person who is awake. So here we have the example of a person who is awake. Then in stage one, here you see that there are lower activities of that is in the brain when one is sleeping. So from here you can appreciate the activities of sleep. Then when you look at stage two, okay, in sleep, you see that the brain activity, okay, become lower with some instances in which we have some kind of twitches, okay, then it is maintained. Then we have stage three, okay, which is deep sleep, and then we see a different kind of brain activity here, okay, called delta waves. Then we have the rapid eye movement, which is very much similar to when the person is awake, but a little bit on the lower side. So, rapid eye movements, the brain activity is similar to the activity when one is awake. And this is shown here at the bottom where we have rapid eye movement. Okay, so non-rapid eye movement is divided in four stages. Okay, so these stages we are going to discuss them, and we are going to find some mnemonics for us to remember. But otherwise, you can still remember them as light sleep, then stage light sleep for stage one, then stage two, waves have slowed down. That is what is happening in stage two. Then stage three, we have the delta waves that begin to appear. So these are the delta waves, okay, in stage three. Then stage four, there's no eye movement or muscle activity. That is what is happening in stage four. Please remember, stage three is also known as deep sleep. Okay, so it takes about 90 to 120 minutes to go into rapid eye movement. And the 90 to 120, okay, minutes, this when this time elapses, then the cycle starts again or the cycle begins. Okay, so here are the stages of non-rapid eye movement, okay, which has got four sub-stages. So we have stage one, stage two, stage three, and stage four. So these can be appreciated in terms of arousal or rate of arousal or vital signs and other activities. So in terms of arousal for stage one, a person can easily be aroused. Okay, and vitals are within the normal range. Then stage two, transition stage. Here, in terms of arousal, this transition, okay, from wakefulness to sleep. The vitals are going to drop slightly. And the other activities that we see is sweating, okay, and also loss of some kind of skin sensation or response. Then stage three becomes very difficult to allow a person who has reached stage three. Okay, so stage three we call also as the deep sleep. Then the vitals here are going to drop further, okay, in stage three. That is why sleep also can help in regulating high blood pressure. When the person is sleeping, find that there is less excitation on the heart. Other activities, okay, so there's reduced skin sensation and also sweating can be seen. Then stage four, it becomes more difficult to arouse a person who has reached stage four because they are more in deeper sleep. Okay, stage three is also known as deep sleep, but stage four, person has gone in deeper sleep. So in a deeper sleep or stage four, we see dropping of vitals. Then the sweating continues. Okay, in stage four here, we can even see sleepwalking, sleep talking, the person who has reached the stage four. Okay, so this is where we see somnambulism or sleepwalking. Okay, or other sleep terror that can be observed. Then, what I would term as stage five or the last stage, okay, because we have two types. Okay, so this one is the rapid eye movement stage. So the two main stages is non-rapid eye movement, which has got four stages, and then the rapid eye movement, which is coming more as the stage five. So in this, it becomes difficult to arouse a person. Okay, vitals can vary, and then there will be rapid eye movement. This is the stage where a person starts having nightmares, okay, dreams, and other activities also can be observed, like penile erection. Okay, so rapid eye movement can also be called as a dreaming stage, a dreamer stage. Okay, because this is where a lot of dreams are going to happen. Okay, so we can break this stage further so that we can understand and we can understand more explanation to the stages, that is stage one, two, three, and four of the non-rapid eye movement stage. So here we have sleep stages with our mnemonic DLDD. Okay, so sleep stages and your body. So we have stage one, stage two, stage three, and stage four. So when you're looking at stage one is more like a person is drifting off from the current environment that they are in okay, to the sleep environment, okay, to sleep environment or to a sleep environment or to a sleep state. So they become drifted off to the realities of the current environment. So stage one can also be looked as a person where the person is dozing. Okay, so it's more like a dozing stage. Okay, if you try to wake up a person in the dozing stage, they will tell you, I was just thinking deep, you have disturbed me, or I just closed my eyes, I'm not trying to sleep. So that is what is happening in the drift off stage, okay, or stage one. So in terms of brain activities, okay, the brain waves, heart, breathing, and eye movement all slow down. And also muscles relax with the random twitches. That's why it's not advisable to those in a group of people or in group of unfamiliar people. You might find that these twitches may result in squeezing a different muscle where sound and may come out. So muscles are become relaxed, and then we have these random twitches. These random twitches can lead to embarrassing sound coming to the other sphincter muscles when they are relaxed. Okay, so from drifting off or stage one, then we have stage two, which is light sleep. Okay, so stage two is light sleep. Here, your body slows down even more. That is, temperature may also drop. So eye movement, okay, is going to stop. Then brain has short bursts of activity called sleep spindles. So in stage two, remember that is where the brain has some burst of activity called sleep spindles. So the spindles can be seen. Okay, so we showed you the brain activities that are happening. Okay, so you find that there are those um, there are those spindles that sometimes are going to happen when one is in stage two. So the body slows down, or further the body activities are further going to slow down. Okay, that is to do with heart activity, brain activity, and also temperature. Okay, it also slows down. That's why you see patients now, it's they will sweat to lose out some temperature, because when one is sweating by convection, you lose some heat. Okay, you lose some heat as the sweat evaporates from your skin. Then in terms of time, stage two lasts about 25 minutes, and then stage one lasts okay less than 10 minutes. Okay, then when we go to stage three, in terms of time, it lasts about 15 minutes, and stage three is known as deep sleep. Okay, functions here within stage three, functions of the body here become at the or they are seen to be at the lowest level. Okay, your body starts to repair itself and starts to build tissue, bone, and muscles. So this is what we see here: the brain starting. um, we see restoration. Okay, so that is functions are going to functions within the body are going to slow there, that is at their lowest level, and the body starts to repair itself and build on the tissue, bone, and muscle. So in sleep, you start growing. In your sleep, you start growing. So in stage three, deep sleep, we see a person starting to grow because of the regeneration of tissue that is happening. Then stage four, which is the dreamer stage. Okay, dreamer stage. This one will last 10 minutes to about an hour. So 90 minutes into sleep, eye movements, heart rate, blood pressure, and breathing speed up. Okay, then muscles become legit or go legit. Then your brain dreams and processes information and also stores memory. So in stage 4, we have memory restoration. In stage 4, a lot of dreams happen, the body becomes stiff, okay? And this will happen, that is 90 minutes after one falls asleep. And it is the fourth stage of non rapid eye movement. Okay, so with all that, then we need to appreciate functions of sleep. So, function of sleep is for restoration. Where is restoration happening? In stage 3. In stage 3, your body repairs itself, which is the restoration. Energy conservation, okay, because of slowed activity. So, energy conservation here, your body slows down even more. So, you see that body activities here slow down. So, there's energy conservation in sleep. Then there's thermoregulation. Thermoregulation because temperature drops in sleep. One will start to sweat and lose heat by convection, okay, to the environment. Then we also see homeostasis, okay, the body trying to control or bring a balance to itself because taking advantage of the rest. So we also see homeostasis. Okay, so those are the functions of sleep: restoration, energy conservation, thermoregulation, and homeostasis. The effect of sleep: if one does not get a lot of sleep, okay, and while we are discussing sleep in mental health, is that it may bring about depression, okay. So it may bring about depression in that if one is not taking enough sleep, they may have ego disorientation, they may have delusions, they may have hallucinations. So it is important to have sleep. So effect of sleep, okay, if you're not having enough, depression can set in, ego disorientation, delusions, and hallucinations. So delusion and hallucination are typical signs of mental illness. Okay, so sleep requirement for a newborn baby, they sleep a lot, can be 12 to 18 hours or 13 to 18 hours. That is how long a newborn baby can sleep. This is to help promote growth, energy conservation, and restoration, or also hemostasis. Then the 2-year-old is going to sleep 11 to 13 hours. Then an adult can sleep 6 to 9 hours. Okay, but for an adult, it can depend. If you are like a student, you might find yourself just sleeping 4 to 6 hours because most of the time you might be busy studying or catching up with the assignments. 10-year-old, okay, they might sleep 10-year-old, they might sleep 10 to 11 hours, okay, and that is what can be seen, okay, to do with the 10-year-old. Okay, so now let us now, okay, before we go to classification of sleep disorders, it is also important to know that in older age, people tend to sleep more hours, like like the time when they were young. So they start sleeping more hours. It is health for the heart, it's health for the body. Okay, so that is necessarily what you see. Please, okay. Um, this is a sleep cycle, okay, which you need to know, and also representing a bit of some hours that we see for each and every stage. So, stage 1, drowsy stage, we see about 10 minutes. Okay, that is stage 1. Then, stage 2, see about 25 minutes. Okay, 25 minutes that one can go. Stage 3, okay, we see about 15 minutes that one can go. Then stage 4 can be 10 minutes and sometimes may even go to 90 minutes. Then we have the rapid eye movement that comes 90 minutes after one, after the time that one uh, took a nap or wanted to sleep. So you find that the rapid eye movement will person who is going to enter rapid eye movement, that is almost 90 minutes after they are taking a nap. Okay, then classification of sleep disorders. Okay, so we have dysomnia. So dysomnia, so when the way that this has been used is sign that there's some kind of deficiency, there's some kind of difficulties. Okay, so this, so these are sleep disorder characterized by deficit in the amount, quality, and timing of sleep. Insomnia, here difficulties of you difficulty of you getting to sleep, and this affects your amount, quality, and timing of your sleep. Okay, then we have sleep apnea, okay, as another sleep disorder. This is a type of sleep disorder that is characterized by an episode of apnea during a sleep. Apnea, absence of breathing. So it's a type of sleep disorder characterized by episode of absence of breathing, okay, during sleep. So there are different types of sleep apneas. So we have obstructive sleep apnea and we have central sleep apnea. So when you say obstruction or obstructive sleep apnea, this occurs due to obstruction in the airflow into the airway, which is as a result of weakness of muscles of the neck. Then this is common in people that are obese. Okay, they may if you are they don't take a good position, they may find that they uh, they affect the patency of the neck, which then affects um, the flow of air into the lungs. Okay, into the trachea to the lungs. Okay, so this mostly we see it happen in people that are obese, that is obstructive sleep apnea. Then the central sleep apnea is characterized by reduced ventilation due to instability of the structures of the brain which controls breathing. So central, like from the central nervous system, this one is coming out as a brain disorder, while obstruction is coming because of blockage that can be seen, okay, if one is especially obese. So clinical features of sleep apnea includes loud snoring. Okay, loud snoring. Here it's more like your snoring is like music, okay, to the neighbors. So snoring is too much. Then there is also fatigue. This fatigue is because of inadequate oxygenation to the brain. So it's hypoxia to tissues. So you feel fatigued when you wake up. Then absence of breathing during sleep. Okay, and then there is non-restorable sleep. Also, clinical features here we're saying there's also non-restorable sleep because of the snoring. Okay, it becomes very difficult to restore normal sleep because snoring there is a sign of blockage or inadequate passage of air. Okay, then in terms of insomnia, we have primary insomnia, okay, which is a type of sleep disorder that is characterized by difficulties in falling asleep. It is also characterized by difficulties in maintaining sleep and also characterized by difficulties in waking up. And then also, primary insomnia is characterized by symptoms that persist for more than 1 month to do with the sleep problem. Okay, that is to do with wakefulness and the likes. Then symptoms should not occur as a result of general medical condition or substance abuse. Okay, so others will abuse certain drugs and especially narcotics, which will affect their sleep pattern. Then primary hypersomnia here, that is phage type. We find that there's this type is a type of sleep disorder with increased daytime sleeping. Symptoms should persist for at least a month, okay, so a month for us to arrive at this diagnosis. Okay, so types of sleep apnea, we have looked at that. Dysomnia, we have looked at it. Okay, sleep apnea, I mentioned that this is the absence of breathing. Because the word near means breathing. The word near at the end of apnea, their absence. Okay, then the clinical features of sleep apneas. Here we said fatigue, loud snoring, absence of breathing, and also non-storable sleep. Then we have primary insomnia. Okay, here, which is difficulties either falling asleep or difficulties in maintaining sleep or difficulties in waking up. So the symptoms like this, they should persist for more than 1 month for us to arrive at the diagnosis. Okay, so primary primary hypersomnia is a type of sleep disorder with increased daytime sleeping. Okay, symptoms should persist for at least a month. Okay, for us to arrive at the diagnosis of primary insomnia. So, in hypersomnia, sleep disorder with increased daytime sleeping. Okay, despite us saying increase daytime sleeping, it is important to have a nap between 12:30 and 14 hours if you are involved in certain works that you do that requires a lot of concentration, because having these naps helps in restoration and improve or restore your mental focus. Okay, so other things to do with primary hypersomnia is that you can start having sleep attack, sleep drunkenness, or prolonged period of sleep, which is non-restorative and also increased time of sleeping. Then the other type of sleep disorder that is there is narcolepsy. Okay, narcolepsy is irresistible desire to sleep. Person wants to sleep all the time. They just want to sleep even when something calls for their attention. Okay, for them, they find so much joy in taking a sleep. So they fail to concentrate even for important things. So it means they have narcolepsy. So the features is having a sleep attack, okay, sleep paralysis, okay, hypo. They can have hypnagogic hallucinations. They also have cataplexy, or they may have bilateral loss of muscle tone, which results in falling. So types of narcolepsy, we have narcolepsy with cataplexy and narcolepsy without cataplexy. So when saying narcolepsy with cataplexy, this is associated with loss of muscle tone. Then narcolepsy without cataplexy, it is characterized by sleep attack, sleep paralysis, and hypnagogic hallucinations. Then we also have narcolepsy with general medical condition or neurologic condition. So sleep work schedule disorder is also another type of sleep disorder. This is a sleep disorder that is characterized by deficit in timing of sleep. Okay, so then other types of sleep disorder can be conditions like jet lag, which is characterized by falling asleep and wakening when it is inappropriate to local time zone. So we see this in jet lag because of time difference, that one would travel and you start from morning and you are a flight that you have taken, it let's say takes 18 hours. The place where you reach, okay, you find that now the time you're coming out of the plane is 02. So you may end up having jet lag okay, which is characterized by falling asleep or awakening when it's the inappropriate time. Okay, then there is delayed sleep phase here, which is characterized by falling asleep and awakening at the desired time, which is delayed sleep phase. Then there is wake shift, which is characterized by insomnia in the night and sleeping during daylight due to the changes in wake shift. Okay, so work shift here like for nurses that work night duties, we find that when you are working night duty, your sleep schedule becomes disturbed. So here you can have a weak shift sleep disorder, okay, which can be corrected the time now when you are not doing a night duty. So work shift sleep disorder, it's characterized by insomnia in the night and then sleeping during daylight due to changes in work shift. And then delayed sleep phase is characterized by falling asleep and awakening at desired time. Okay, other types of insomnia also okay, includes parasomnia. Okay, so from sleep wake schedule disorder where we have jet lag, delayed sleep phase, and wake shift. So all these are sleep wake schedule disorders. So we have now parasomnia, which is a different type of sleep disorder. So, parasomnia is a sleep disorder that is characterized by physiological behavior, cognitive perceptual abnormalities that occur during sleep. Okay, like sleep transition and sleep wake. Okay, so this is a person who has the parasomnia. So, there are types of parasomnia which can include night terror. So, night terror is a type of parasomnia sleep disorder which occur in non-rapid eye movements, okay, characterized by the following: that is, child screams, child becomes deluded, autonomic arousal, that is, sweating and palpitations, episodes of amnesia afterwards, hallucination, which can be visual most of the time. The night terror occur 2 hours after the onset of sleep. This is common mostly in children between 5 and 6 years. Then we have the nightmare parasomnia. So these are flight and vivid dreams which occur in rapid eye movement. These are dreams involving security, survival, and this is common in children between 5 to 6 years. Then there is sleepwalk parasomnia. Okay, apart from nightmare, night terror, we have also sleepwalk and so parasomnia. This is a type of sleep disorder which consists of ambu- ambulating, okay, which occurs whilst one is asleep. Okay, there is also an episode of mechanical movement, e.g., walking to the toilet, an episode of amnesia afterwards, difficulties to be awakened and associated with sleep walking, and occurs in non-rapid eye movement. Okay, so for children here, they can even go and urinate in a pot, okay, in a pot or in the kitchen if you don't cover your pots. Okay, so in terms of treating people with sleep disorder, we can use methadone, we can use Ritalin, we can use antidepressants, we can also use psychotherapy management, cognitive behavior therapy. Okay, all these can help. Apart from that, you also need to do cognitive behavior therapy, which should help the patient to adjust to changes. Okay, so with that said, what do I just want to do is to summarize some of the sleep disorders that we have talked about. So, the sleep disorders that we have talked about in this lesson include insomnia, and we have said insomnia involves difficulties falling asleep, staying asleep, or experiencing non-restorative sleep despite having opportunity to sleep. It can either be acute, that is short term, or chronic, long term, and may be caused by factors such as stress, anxiety, depression, or certain medications, mostly narcotics. Then sleep apnea. Okay, here we said sleep apnea is characterized by interruption in breathing during sleep, often due to a collapse of the upper airway. Common symptoms to do with sleep apnea include loud snoring, gasping for air during sleep, and excessive daytime sleepiness. There are two main types. We have the obstructive sleep apnea, and we also have the central sleep apnea. Then we also have narcolepsy as a sleeping disorder. Narcolepsy is a neurological disorder that is characterized by excessive daytime sleepiness and sudden, uncontrollable episode of falling asleep during the day. Individuals with narcolepsy may also experience symptoms such as cataplexy, okay, that is sudden muscle weakness or paralysis, or may have sleep paralysis and hallucinations. Then there's also restless leg syndrome. Okay, so restless leg syndrome, okay, abbreviated as RLS, is a condition that is characterized by uncomfortable urge to move the legs, usually unaccompanied by sensation such as tingling or crawling. Symptoms often worsen during periods of inactivity, particularly at night, and can lead to difficulties in falling asleep. Then we also have parasomnias. Okay, so parasomnias include a variety of abnormal behaviors or movement during sleep, such as sleepwalking, night terrors, and sleep related eating disorders. These behaviors can disrupt sleep and may pose safety risks. Then we also have a sleep disorder that we have talked about here, which is circadian rhythm sleep disorder. Circadian rhythm sleep disorder involves disruption of natural sleep work cycle, often due to shift work, jet lag, that is jet lag, or irregular sleep patterns. Conditions like delayed sleep phase syndrome and advanced sleep phase syndrome are examples of circadian rhythm sleep disorders. Then the other sleep disorder that we discussed is hypersomnia, which refers to excessive daytime sleepiness leading to prolonged and unrefreshing naps during the day. Conditions like idiopathic hypersomnia and Quine-Levin syndrome fall under this category of sleep disorder. So, from me, I'm saying thank you for listening to the lesson and keep studying.